Hello again, everyone. My name is Marty Guthmiller. I'm the CEO at Orange City Area Health System. We have a familiar face with me today, Dr. Al Laird, making his third appearance, I believe, on this 21st day of May with the 21st edition of the COVID-19 community briefing. So thank you all for joining us. I do have a fair amount of information today, and Dr. Laird will be certainly contributing to that as well. I'm going to start off with the scoreboard, and before I begin with this, I just want to mention that the Iowa Hospital Association yesterday published in their newsletter the fact that Iowa has received an A+ from the Atlantic, who is an organization that's monitoring the quality of data that's being presented relative to COVID-19. And so there's nothing wrong with an A+, right? I mean, but you have to know its source. But it's also really important that the data that we're giving you can be relied on. And it's nice from an independent source to be able to say Iowa's right up there with the best in terms of the data that's reported, the reliability of it, and that's really good. So that should be a little confidence in the numbers that we're talking about. Now, they're not talking about these numbers that I'm going to give you, and these are our local numbers. But they are accurate. We are currently at 161 tests. We have 15 positives, no hospitalizations currently. That positive rate to total test is about 8 to 9%. And so we're staying within that range pretty consistently throughout the season that we're in. We have 2 tests that are currently pending, and we have 144 of the 161 that are negative. So again, not a lot of activity there in terms of serious illness. We are getting a few more positives here and there, but again, within the ratio, as our testing goes up, we should expect maybe 1 out of every 10 or 12 to be positive. So I want to talk a little bit about hospitalizations also, since I mentioned that we did not have any hospitalizations here in Orange City. Sioux County, in fact, has 0 right now. Lyon County 0, O'Brien County 0, Plymouth County 2, and Woodbury County 54. So that's down a little bit in Woodbury County. I think the last time we talked a couple of days ago was maybe 57. So that hospitalization rate is down, and that's out of 381 in Iowa. Polk County still leads the pack with the number of COVID cases there, and that's been consistent, and obviously with the population base, that makes some sense. I want to jump back a little bit to the county level again. There are currently, according to the website, and by the way, I'm going to give you that website again. This is a fairly new website. There's coronavirus.iowa.gov, and you can go in there and feast on all kinds of data. We now know that it is A+. You can count on it. And it's a very good site with a lot of detail. And I give you just some summaries of there. But again, coronavirus.iowa.gov. Number of county tests performed are 826, 179 positive. Now that's a 21.7% positive rate, which is higher than what you would normally expect. I mentioned our rate is 8 to 9, which is kind of consistent over time. But there are a couple organizations in our county that made that spike up a little bit. So that percentage actually is down as we're doing more tests. That percentage starts to go down. So 826 in the county, 179 positive, no hospitalizations. Speaking of testing, we have learned just yesterday that Test Iowa will be coming to Sioux County, more specifically to Sioux Center on May 27. And I've asked Dr. Laird to talk a little bit about Test Iowa, maybe what they actually test for, how they test, how you get a test there if you want it. My understanding is that this will be next week, May 27. It'll begin, and will be located in the high school parking lot, I believe at this point is the information that we've received. And that is organized and ran by the Department of Transportation, the National Guard, and the Iowa Department of Public Health. So Dr. Laird, could you talk a little bit about Test Iowa and what that means to the average consumer?
You bet. So Test Iowa has been present in Sioux City now for at least a couple weeks. It is, as Marty pointed out, state-sponsored. And you start out by going to their website, which is testiowa.com. It is not a .gov, it is a .com. And then you will be asked a series of questions. Depending upon your answers to those questions and what criteria they have in place at the time, they will either tell you you do not qualify for a test at this time, or you do qualify. I have, on the early days when it just started, ran through it to get an idea. It may have changed since then. I haven't repeated it. It is not always dependent upon whether you have symptoms or not. Some of it depends upon employment, whether you're a healthcare worker, and other factors like that. But once you answer those questions, then either you will be told you qualify for testing or you do not qualify for testing at this time. If you do qualify, at least when I checked it, you would get a tracking number, and then you would be given a number to call, and you give them the number, and then they schedule you for a time. And then it is essentially a drive-up situation where you drive up at that time and they do the testing. I do understand that the coronavirus is tested for, and at one point they were backing up. They were doing a fast test, but they were also backing it up with going to the state lab with viral media. I do not know the status of the fast test at this time. As many probably are aware in the news, some of our faster tests were called into question recently. So I apologize that I don't know the answer as to the exact methodology they're using, but it is being qualified, being checked at the state lab, and then results are sent to you. My understanding is you have to give them an email or some form of contact, and then they will send the results directly to you. It does not go to your physician or your healthcare provider. You would need to in turn inform your healthcare provider, should you choose to, about your test result.
So thanks. So you go to testiowa.com, follow the instructions there. At what point do you give a credit card? Do you give an insurance filing?
My understanding is it is not. There's no charge with this because it is the state who does it.
Okay.
And they have obvious funding from both federal sources and state sources. Again, things may have changed since I checked it 10 days, 2 weeks ago, but my understanding is that it is a covered event for people.
Okay, great. So again, testiowa.com, go through the requirements that are there, and if you so choose. The key thing with that, and one of the key messages that Dr. Laird said, is that they do not report to your provider. And so it's really important for those of us on this side of the equation to know who we're dealing with and know the positives we're dealing with. And that'd be very helpful that we get those results. But that is on the burden of the person being tested, not the agency themselves. So look for the numbers in Sioux County to go up dramatically in terms of the number of tests. Now, I would hope and trust that the percent of positives go down now as a result. If Sioux County is at 21.7, it should go down because our denominator is going to go up significantly. So people want to know.
We believe so, we hope so, but it will give us closer because we know that we are not testing everybody all the time. Right. It may give us a bigger picture of exactly what's going on.
Right, exactly. I'm going to shift gears just a little bit, and then we're going to come back to Dr. Laird on another topic, but just long-term care. We are aware that Iowa is putting together and working on a testing scenario for senior care entities. I think that includes both residents and staff. Don't know what that is, but we know that they're working on some protocols for that, making sure we have the medium. Maybe a Test Iowa, for example, might be used in a situation for nursing homes. We don't know. We haven't been informed that yet. But probably more importantly is the potential for relaxing some of the restrictions that we currently have in place. That's really important for us. We are going to, whatever kind of recommendations or guidelines they give us, we're going to run through our own people, our own medical staff, our own infection control. We want to be reasonably comfortable. I don't think we'll ever get to the point of being comfortable of opening things up, but we want to get back to some degree of normal as soon as possible. And if we can at least get a few visitors, in, and maybe it's spouses, that kind of thing. And with screening and protocols and all that, that's really a high priority to us. And once we get these guidelines, we're going to look through it. And again, when our local community looks at this, our community of medical providers looks at it and has some degree of comfort if some of the guidelines make sense, and we're able to adhere to them. That's a minimum standard for us to follow. We may decide to follow a little bit more. So that's coming. In the last few briefings, I've talked a lot about controlling what you can control, and to be thinking about things that, again, we're likely to be infected at some point. Flattening the curve doesn't mean we won't get it. Flattening the curve means a longer time over which we might get it, closer to treatment, closer to vaccine, those kinds of things. And to be working on things within our realm of control, like losing weight, managing your diabetes, managing your hypertension, things like that. Making sure that you do your well child visits, your immunizations, your colonoscopies, your mammographies, things like that. We've talked about that a lot, and that remains very important. Today, we were made aware of a letter that was sent in by 600 physicians across the United States. Dr. Laird was not one of them. But 600 MDs that sent a letter to President Trump, basically referring to the shutdown as a mass casualty event, meaning that a number of things that people have kind of put on hold for the time being, the screenings, the undetected cancers, the maintenance kinds of things that we normally do, are being foregone. And so the gist of it is the real cost of COVID-19 in terms of lives could not be measured by the death certificate saying COVID-19, but could be measured by things that are foregone in today's world that would have been caught yesterday. I've asked Dr. Laird maybe to comment a little bit, not to endorse the letter, not to endorse anything else, but simply to talk a little bit about that well child screenings, immunizations, preventive kind of care.
I think those are very good points, and it's easy to let COVID-19 suck all of the oxygen out of the room to where it's the only thing we talk about. But it, by its nature, has not made any other disease go away. And we've all read the accounts of the gentleman who stayed home with his crushing chest pain because he was afraid to go to the hospital and died of his heart attack. And we can't say he wouldn't have passed away even if he came to the hospital, but it seems like there has been this leaning towards putting things off. And we do want to remind people that cancer hasn't taken a holiday, heart disease hasn't taken a holiday, hypertension, diabetes, none of these have taken a holiday. So please continue to do your well checks, communicate with your provider, where appropriate, come in and be seen if you have a medical need. We are doing our best to make sure that we have a safe environment for everyone to be treated here. And that doesn't mean that we're perfect. Perfect is not something in medicine we get to obtain, but we do our level best to try to make sure we're there to meet your needs. So don't put things off would be the encouragement. Do your screenings and talk to your provider about your well visits. Talk to your provider, and I would say your well child immunizations. The worst thing that could happen to us now is now we have a measles outbreak because we're not getting our immunizations against measles. And so I would highly encourage people to continue with those things, particularly as we begin to open things up and monitor the disease. And we feel like the U.S. has done a good job of flattening the curve. We feel like Iowa has done a good job. I realize that this will be debated for years as to whether the job was good enough or could have been done better. But please don't let that impede your taking care of yourself and getting the help that you need and the medical care that you need.
Good, thank you. I also noticed in there too, dental procedures, routine dental procedures being not followed up with are a concern regarding the related heart disease and things like that.
Absolutely.
And so don't forget to take care of yourself from a dental perspective either. You know, another thing that hasn't taken holiday is having babies.
Amen.
You know, people are still having babies. In fact, and maybe on a positive note, and to end on this, we have a bit of a baby boom going on this week, particularly at Orange City Area Health System. I think we're having at least 10 babies this week by my unofficial latest count. And one of the things that you know, our renovated labor and delivery rooms, we've added one now, so we have 3 instead of 2. We are ready to open that thing up and ready to go in February, right before this hit. And so we're not able to go up there and really show anybody anything in terms of getting cameras in and doing an advertisement or putting something out on Facebook, because we don't want a camera crew in that area for some obvious reasons. But trust me, the area is very nice. It's being enjoyed by the people that it was intended for, and particularly this week. And so those 10 families this week are enjoying that, and we're really giving the new renovation a run for its money and kicking the tires big time up there. So life does go on. We continue to be here, and we appreciate the trust and confidence that you place in us to do so. Dr. Laird's talked about everything that we're trying to do to keep this place as safe as possible, and I think we're doing a decent job on that. I also like to say it's really unfortunate that you as a public cannot see the effort that's being done by people like this right here, in terms of Dr. Laird's expertise, the effort that he's putting into it. Again, all behind the scenes in terms of making things as safe as possible. He's doing a great job, and he has other people beside him who are doing this, and we're very fortunate in the community to have you, Dr. Laird, and thank you for your selfless commitment to that. Really appreciate that.
And I would be remiss to say that there's many people on this team, including Marty, but many, many others who are making that possible, down to the very nurses, those that help us with cleaning and make sure our rooms are clean, those who see people every day at the clinic and greet them, who are doing their level best to follow distancing guidelines, to follow appropriate guidelines to keep things safe, and to deliver care in the kindest fashion that we can in this day. So.
Thank you. So we're going to close. We want to be your partners for health and wellness. We thank you for trusting us. And as we've been used to saying on these things, stay vigilant, stay strong, stay healthy. Thank you again for joining us.